Welcome to Live Well with UCI Health. I'm Ryan Manno from KOST 103.5 and iHeartRadio. Very pleased to be joined today by Dr. Shalini Shah. I want to get your title. Vice Chair of the Department of Anesthesiology and Director of Pain Services at UCI Health Center for Pain and Wellness. Dr. Shah, thank you for being here.
My pleasure.
So let's talk about pain, and not the kind that comes with waking up every day. Like the, physical pain. And I think it's probably safe to say that most people, as we age, deal with pain pretty regularly, if not constantly.
Yeah. The way we think about pain right now in the country is episodic. It happens for a small time. I hurt my knee, I sprained my ankle. But there's a whole segment of people who are living with pain chronically. It's a part of their everyday life. Mm-hmm. It's going to be a part of who we are as we age, and that's a fact. And so how do we get ahead of it is really what we're focusing on here at UCI.
First, let's talk about the difference. There was a question, there was some terms on here that I wanted to bring up to you. The difference between lifespan and health span. What is that?
Yeah. So we hear a lot of these buzzwords. We hear the word lifespan. That's just how long we're going to live.
Okay.
And then we talk more about health span, is those lives that matter, or those years that matter, the quality years. And I'll tell you, just yesterday in clinic, I saw probably 7 out of my entire panel for the day were patients who are 90 plus. And those patients are going to easily touch 100 without any difficulty. So people are living longer.
Right.
And they're healthy, to be honest. They're living longer, healthier lives. And so how do you get to be that one of those special types of people, where you're able to manage, you have a little bit of pain, and you keep that pain episodic and not chronic?
So how do you?
Here we go.
Yeah. So typically, as I'm understanding it, your health span will almost always be shorter than your lifespan.
Yeah.
Right? For most people.
Really well said. Yes.
Is that right?
Yes.
Okay. So how then do we, and maybe you don't have exactly the answer, because if you did, then everyone would be wanting to know, but what can we do preventatively to give ourselves a good shot at a nice health span?
If we look at it, I like to say it in a 360 view, and I don't want to get too nerdy on this topic.
Nerd out. Let's go.
There's some metabolic factors, just, insulin resistance, visceral fat, things like that. Muscle, and we'll talk about muscle in a second.
Yeah.
The second is some biological markers that most people don't know, that they're going to the gym every day and they don't know that these are the markers that predict a long life. And that's grip strength. So if you do grip strength at the gym and you measure that, you can even buy a tool off of Amazon to measure that and to see if you can improve that. And hanging. If you can hang even for 5 seconds, that's a great marker to tell you how long you will live and how the quality of life would be.
Hanging. And gripping. Mm-hmm. That is so interesting.
Yeah. And that's apart from all the metabolic factors,
Sure.
what we put in our system and how our metabolic rate runs. But yeah.
Wow. Mm-hmm. Let's talk about some of that metabolic stuff. Like what do you mean when you say that? Can you go a little further on that?
Yeah. So if you're in pain, you're probably not moving because it hurts to move. Mm-hmm. So you're putting on weight, and that's visceral fat, so that deep layer of fat. And that is a huge marker for why we age so fast.
Okay.
Because that fat leads to inflammation.
Yeah.
And so inflammation, visceral fat, these are all the metabolic things that limit how fast we can process either foods or metabolism, things like that.
But right? So for you and what you specialize in, then these things are related to pain.
100%.
Okay.
Yeah. That's our goal. It's, yes, you have pain. We will all have pain. But how do you work past that to keep those metabolic markers strong?
Mm-hmm. You mentioned chronic pain. Mm-hmm. What separates a pain, just like a nagging pain versus like when does a pain become chronic?
By definition, it's anything longer than 6 weeks to 3 months, right?
Okay.
Most commonly, the number one reason why people go and seek a doctor for pain is typically low back pain. Uh-huh. And that's about 70 to 80% of what we do and treat is low back pain. And to be honest, that's the space, if people want promise in the world, that's the one space that's really improving. A lot of new technologies coming out. A lot of non-invasive. We used to think we need spine surgery. There's a lot of things that you may not need now. Mm-hmm. So that space is really improving, and so you're going to see a lot more treatments available to take care of that. The part that is harder to treat is frailty. So as we age, we get frail, and that means we're losing muscle mass.
Yeah.
And as we lose muscle mass, we're not moving as much. We can't support our skeleton. It's painful. And then you see the hip fractures. And then once you get in the hip fracture, then you go to the hospital, and then you need a convalescent home and all that entire cascade that we see with our parents and our grandparents,
Yeah.
And that's what we're trying to break. And so a lot of what we're trying to teach our patients is about building that muscle mass. So after the age of 30, we lose about 3 to 5% of our muscle mass every decade. Just that's normal. We will all do that. But after 60, we start to lose about 15 to 20% of our muscle every year. And I've seen those patients who've lived to that 90-year mark or 85, 90, 95-year mark, they still have preserved muscle. They're still going to the gym every day as much as they can to keep gaining that muscle so they don't become frail. Mm-hmm. Yeah.
And would you say that if you had to just, your own, not your own research, but the things you've observed, your own observations, is that a commonality in those people that have not only the long lifespan, but the long health span? Is that muscle mass, is going to the gym?
It is.
Yeah.
Almost one of the things that I can correlate so truly is that muscle mass. Mm-hmm. I wish we did a better job in nutrition or teaching medical students about nutrition, teaching our physicians about nutrition to educate our patients and about these things because they're simple. They're not complicated, simple things that we could do.
And if you do them, my dad always preaches this. I mean, he's 78 and he swims every morning. He's at the gym every morning. And he's always telling me, get ahead of it now or make it part of your life now. Because then when you get older and you just try to play catch up with your health and it's like, but you could have been doing that a long time ago.
Yeah, you could have done the preventative stuff.
Yes. Right? And so starting it now, even, no matter how old you are, it's never too late to start.
Yeah. And it's never too early to incorporate a lot more protein into your diet. For a healthy 40 to 50-year-old female, taking about 100 grams of protein a day is very easy. It's a very good thing to do.
Yeah.
To build that muscle mass.
And it's interesting, too, because I think when you're not thinking about it, you're just going through your day, you're not thinking about how those things correlate and then lead to pain. Mm-hmm. And they're coming to see you going, whoa, my lower back's messed up. By the way, why is it if I think about sleeping on we had sleepovers as kids and we would all just sleep on a floor.
Yeah.
And nothing happened, right? We have a sleep number bed at home and my side has a leak in it and it'll sag a little. And I swear those mornings when I'm like, what? Did I get in a fight? My whole body is and I'm 45.
Yeah.
But we hit a point where even the smallest little difference in our day-to-day can cause pain and it can ruin your day.
It can. You tweak that muscle wrong. Usually it's muscle, thank God. But yeah, you're absolutely right. You feel it. You're feeling it.
Yes.
Right? You're feeling it. Where the discs are not as supportive as they are or they once were, so you need more support from a firm mattress. Yeah, we feel it.
Yeah, and it really does. It inhibits your enjoyment of life, when something's nagging at you or worse than nagging. What are some of the ways pain is treated today?
So you're probably going to hear the word often multimodal. And what that means is many ways at the same time. So it's not just prescription painkillers or medications. It's not just physical therapy, but it's everything together. So that's what we call multimodal. We try to treat it aggressively through many means as fast as we can because we need you to get back moving and building that muscle mass.
Yep.
Right? So it's medications, injections sometimes, and people think, well, do I get these forever? And the answer is no. You should not be getting them forever. Usually it's a series of a couple injections, and then you should be better, provided you're doing all the right things, physical therapy, rehabilitating. So some of that, sometimes you need surgery, and we've got great surgeons here at UCI that we partner with, and they're minimally invasive. I'm talking about an inch of an incision, and you take care of the problem. But the point is we take care of the problem. Yeah. Don't let it linger.
You mentioned prescription painkillers. Where are you as a doctor, and this is your life? Yeah. Where are you at on opioids?
That's a good thing. It's one tool in the toolbox, I always say. They have a role. Patients are in pain, especially after surgery. They're going to need them. And we need to have them so patients can move and function. But the longevity of using them forever and ever and ever as medications, probably not the best idea.
Yeah.
And we've got better things that are much more safer and less harmful.
How do you tackle, you mentioned you've got the toolbox. I love that term, that phrase. How do you tackle if someone's dealing with pain with other comorbidities?
It's a great phrase that you use, comorbidities. When you're dealing with pain and then you've got all sorts of other problems, you've got heart disease, you've got, maybe COPD from smoking cigarettes or, what we're seeing more than diabetes or heart disease or lung disease now is anxiety and depression.
Really?
Seeing a lot more mental health. And that's one of the biggest barriers to overcome when we're trying to treat pain.
Talk about that. Why? How? What do you mean?
I don't know if it's generational or not, but we're seeing younger folks, and I mean 20s, 30s, 40s, who are coming into us as patients with pain, who also have considerable amount of anxiety that they're dealing with, whether it's workplace stress, coping skills. And I don't know if it's a generation where they were the cell phone generation, where to cope, they went to the cell phone. Or, sometimes we just scroll, and that's the way we deal with our stress.
Yeah. So, but how does that then, so I'm fascinated by this. How does that then get in the way of what it is you're trying to treat?
Oh, great question. So what most people don't know is that pain, anxiety, and depression travel together.
Really?
And they synapse at the same places in the brain together. So if you have pain, likely you will develop chronic pain, some element of anxiety and depression, and vice versa. So if you have anxiety and depression, you will also at some point develop pain. And so they're what we call comorbid. They exist together. So if I'm trying to treat pain in someone who's anxious or who's severely depressed, it's very difficult. I have to treat that anxiety and depression component first because they travel together. Yeah, most people don't realize that.
No, I never would have thought that would have been on your plate to also handle that other part of it.
Yeah. So we try to have a psychologist with us, a pain psychologist, and they're a wonderful resource for us.
Now, do all places do that, or is that just like something that you guys offer here at UCI Health?
We're one of the only places here in Orange County that really has an inbuilt pediatric and adult psychology program in addition to pain physicians,
This could be a completely dumb question. Most are that I ask on this series. Do you think that there's something to this idea of like once you convince yourself you're in pain, or you are in, like, does thinking about pain and focusing on pain make pain more painful?
Oh.
Do you know what I'm saying?
Yeah.
Like, can you almost work yourself into more pain by focusing on the initial pain?
Yeah, and we have a word for it.
What is it?
It's called perseverating.
Perseverating. Yes. You learned it here. See? I knew there was something to that. Okay,
Yeah.
Let's talk about perseverating.
So perseverating on the pain absolutely can make it worse. You're constantly focused on it. You're micromanaging it. It's always in the forefront of your headspace. There's a term for it. It can actually make your pain worse. And we see this a lot in migraine patients. Sometimes migraine patients, they keep migraine diaries. I had a migraine at 6 a.m. It went down at 8:45, and it came back up at 1:10. And they're constantly keeping diaries. And we try to tell our patients, don't do that because you're constantly focusing and thinking of pain.
Yes, that's right.
Yeah.
Do you find, or have you encountered, that some people, this might come out the wrong way, but like, they don't want the pain to go away because the pain, the attention of the pain, or is that a thing? Do people say they don't want to be in pain, but they it's like, that's my thing, I'm always in pain?
See that time to time, not as often as you would think,
okay.
but I know what you're talking about.
Yeah.
Some people live in pain. That's their life.
Right.
Oh, that's the hardest type to treat,
The ones that are always in pain.
Yeah.
Because probably one pain leads to another pain too. It's funny, there's an actor, Walton Goggins.
The White Lotus.
Boom! Look
Yes.
at you. Look at you, doctor. So he he was on set, and he put out this video on Instagram the other day where he was saying he did something, he like tore something in his quad or something. He's going to physical therapy, threw out his back, led to an ankle sprain. Like, it was boom, boom, boom. And he said, as I've gotten older, I have learned that if you want to live right, you got to keep your glutes tight. And so he's like, when I walk, I squeeze my ass. And it's helped me prevent so many other things. So he was just like, when you walk, squeeze your butt cheeks. Just clench your butt and build up that muscle mass, right? And it's preventing him from having further injuries because of these other things.
I wish I could comment on that one, but...
Anyway, that was what he said. I don't know. But it goes back to your muscle mass part.
Yeah.
Work on your muscles.
Constantly
keep
keeping
yourself
them
strong.
Under tension, yeah?
Yes.
The other part that we don't talk about, and it's, I don't want to make it sound that it's not scientific, but it is scientific, is your headspace. It's meditation and things like that. And what I mean by that is, if you look at those patients who've also lived to their mid-80s, in their 90s, about to touch 100, one of the strongest thread points that we see, and this is not just my patients, I'm saying from data sets, is that they have some element of meditation or some element of non-reactivity. They're not reactive in life. They're not letting things get to them on a daily basis, on an hourly basis. They've got that mental the strength to maintain a non-reactive environment. And that's also really important for a health span.
Sure. It can be hard to do, especially with everything coming at us at all times, And you can try and you can make it a point to not engage a reactive mind, but sometimes it'll hit.
Yeah.
What do we see on the horizon for pain management with what you're doing? What are some things you're looking at that you're like, I like this. This is good.
Oh, like I said, it's a great space to be in because of all the spaces of all the diseases that we're treating in the United States right now. Pain is the number 3 disease, apart from heart disease and diabetes. And that space, from a technological standpoint, it's booming. It's booming. We've had new devices, new therapies coming out that are non-steroidal, so you don't need to have steroid injections all the time. They're non-permanent, so you don't need a surgery. It doesn't have to be invasive. And they can retrain the brain of how to think about pain or how to train those pain signals from stop firing. Yeah, it's amazing. It's an amazing space to be in. I think in the next 1 to 5 years, we're really going to make a big headway in the way we treat pain in this country. Yeah.
Really? So wait, talk more about that. It retrains what now, or does?
Yeah, it retrains the brain so that, the longer you have pain, you mentioned it, there are some people who live in pain constantly, and those cells then change over time to allow more pain. They need to feel pain in order to survive, the brain cells. So the new therapies that are coming around are working on that, what we call plasticity, so it doesn't become permanent. You can actually change the way the brain thinks about pain. And the brain adapts to pain signals that are coming from the spinal cord.
That's crazy in the coolest way.
Yeah.
Oh my gosh, how exciting for you too to be in that space. One of my favorite things as we've done this series is to talk with doctors about how technology advancements, be it AI, or I've talked to some doctors who do surgeries with like the Apple goggles on now, like the headsets. How is this stuff coming into play with what you specialize in?
A lot of ways, a lot of out-of-the-box ways that you wouldn't imagine. For example, we use virtual reality goggles to help treat pain or when you come in for a pain procedure, so we can distract patients from the painfulness of the procedure itself.
That's cool. So
Kids love it too.
Give me an example of am I swimming with dolphins while you're treating my pain?
Whatever you like, actually. You could put on iHeartRadio if you wanted to.
This is phenomenal. That's so cool. I love that. And like you were saying, kids love that too, I'm sure.
They love it. We use it in the hospital too. You come in for an infusion. It could be painful. Wear the goggles and you don't experience pain. You're totally distracted by it. Patients have a great experience with it. That's some of the things we do. Some of the new technologies that are coming out where you don't need surgery. We can burn the nerve that causes the pain, destroy it. Minimally invasive, no needles, no sutures, nothing. And so that's giving a lot of promise to people.
That's cool. What excites you most about what's happening at UCI Health and your team and what you're seeing, like specific to UCI Health and the way you guys handle this?
I think we're very unique. You're not going to find many pain centers, locally, but definitely not in the country, that do what we do. And I'll tell you why. Part of pain is treating the pain, but sometimes you do need surgery, right? We're very unique in that our pain physicians are also in the operating room with the surgeons, and we know who's good, who's not, what they excel at, and we can talk to you about very specific things and send you to the right person. Oftentimes you get a referral, you're like, you go see the person, you're like, this is not the right guy for me, or this is not the right, how does the referral system work in the United States? It's broken. But that's what we do really well here. We have a really consolidated system where we know everybody, they know us, we work down the hall. We have somebody who says, look, we say, you really need to go talk to a surgeon. We walk down the hall with you, introduce you to the surgeon, and they see you right away. And we help you handpick the right referral.
So it's like team healthcare.
It is team healthcare, but it's very personalized in the right way,
Yeah.
How do you find a doctor? Your kid needs a doctor. How do you find a doctor?
I don't know, go online or something.
Yeah, you find, random health grades or Yelp.
Right,
Use
for
Yelp
sure.
to find,
Yeah.
Yelp for a dinner reservation, but not for a doctor, right?
Totally.
Yeah.
Yeah, so that's awesome. I love hearing that and knowing that. That's a great thing. Anything else that we should touch on, that maybe we haven't talked about that you think is important for people to know, that maybe watching this or hearing this that are living in pain?
I think there's hope. There's definitely hope on the horizon for whoever's listening out there who has pain, whether it's knee pain as we age, arthritis. My God, we're all going to get arthritis, right? Do we all need hip replacement surgery? No. What else is out there? So we've got a lot of new therapies that we're rolling out at UCI almost every few months, really. And so I think there's a lot of promise to people who are living in pain.
Yeah.
And then It's also good pain care. Sometimes you may not gel with the right doctor, or you may get sent to a quack, or I hate to use those kind of words,
but it's true.
You don't know who is who, but we select our physicians very, very carefully. We bring in doctors from all over the world: Harvard, Stanford, Cleveland Clinic, and they're all here at UC Irvine.
Yeah.
And so we really try to create a team of pain physicians where you don't need to go to the Cleveland Clinic. You don't need to go to Harvard because they're here
That's
at
amazing.
UCI.
That really is. Mm-hmm. All right, just a side personal question. If you get a headache, doctor, what do you take? What do you do? What do you do specifically?
Caffeine.
Really? Okay.
Caffeine's the best thing you can do.
Yeah.
Yeah.
What about like if if your knee hurts, your knee's sore? Then what are you reaching for? Not caffeine.
Not caffeine. Usually it's an anti-inflammatory. Oftentimes, 8 to 10 out of 10 times, it's going to be an inflammation process.
Okay.
So your ibuprofen, your anti-inflammatories, naproxen, those types.
Okay, good. Those were just personal, selfish questions. My playlist says it's the 90s. My lower back says it's not. Doctor, thank you so very much. We appreciate you.
Oh, it's my pleasure.
This is awesome.
Thank you.